when your doctor should consider giving you a combination of anti-sickness medication. At this stage, you may then be given a drug from the first line class and then a drug from the second line class. Very often, most women respond to a combination of antiemetic therapy. Now, let's move on to the group of patients or the group of pregnant women who do not respond to a combination of antiemetic therapy. At this stage, we should be thinking, could this be hyperemesis gravidarum? So she's had 2 drugs and it's still not working. She's still vomiting, or she still has excessive nausea to the extent that she's not able to eat. And even more importantly, she cannot even take her antenatal vitamins. Then we are starting to think out of the box. If that's you, you should at this stage have the conversation with your doctor to say, doctor, could I be going through persistent or severe hyperemesis gravidarum? It is very likely that you are. At this stage, your doctor should be sending you to the hospital for you to have the anti-sickness drug through your vein. Women who experience persistent vomiting, or even when nausea is so severe that they can't eat, they can't drink, they are likely to start to track towards dehydration. When that's the case, you should not only be sent to the hospital to just have the anti-sickness through your veins, but for also fluid rehydration. Your doctor should be sending you to a hospital, or if there is a facility in your doctor's clinic, to set you up on an IV drip. According to the Royal College of Obstetric and Gynecology in the United Kingdom, the first type of fluid that you should be given is normal saline with an additional amount of potassium in each bag. So, as promised, here is a list of all the first line, second line, and third line anti-sickness medication that you should be given. It's a very exhaustive list and can be quite overwhelming. If you take the time to go through it, it is very standard. And your doctor should have access to this list. And remember, if your doctor has tried a drug from the first line, he or she should be trying a drug from the next line if you're going to go for combination therapy. So in other words, what I'm saying is you shouldn't have 2 drugs of the same class. So no, you shouldn't be given 2 drugs from the first line treatment or 2 drugs from the second line treatment. It should always be 1 from the first line, 1 from the second line. I hope that makes sense. So some of you who have suffered from nausea and vomiting in your pregnancy, particularly if it's been persistent and you and your doctor, you've just not managed to keep a good control over it with, just oral treatment. And a lot of you have thought, why doesn't my doctor just send me to the hospital and to give me intravenous fluid? The challenge with that is that so many women experience nausea and vomiting in their pregnancy, and in a public healthcare system, for example, like the NHS, or in other countries like Australia, when it's mainly public funded, it's difficult to admit every woman to the hospital because they are experiencing nausea and vomiting. There are just not enough beds in the hospital.